The Omicron variant is officially in the U.S. tonight, and it is popping up in even more countries as well. Many, in fact, closing their borders to travelers in an effort to try to curb the spread. So far, Nigeria, Japan, South Korea, and Saudi Arabia have all recorded their first Omicron cases. And this after South Africa reported the first recorded case ever a week ago. So now here in the States, that first case of the variant identified on the West Coast. The CDC reported it was found in California in a person who traveled to South Africa and returned to the U.S. on November 22nd. Health experts suspect it is only a matter of time until it is discovered in the Carolinas. So what makes this variant different, and what does it mean for the future of the pandemic? WCNC Charlotte's Chloe Leshner joining us from StarMed's vaccine clinic on Tuckasegee Road. So, Chloe, what are health experts doing to get ready for this new variant?
Well, variants pop up because viruses are mutating all the time. That is normal. But Omicron has a lot of changes in its genetic code, and that could present some challenges. So researchers right now are working to figure out if our current vaccines will protect us against it. Our world has changed throughout the pandemic, and so has the virus itself. Researchers in genomic sequencing labs in the Carolinas keeping their eyes peeled for Omicron, the latest variant of concern.
Certainly from what they're seeing in Southern Africa, it seems like it does have potential to cause another wave. There are some indications that it may have the potential to escape antibodies.
It's still not clear if current vaccines will protect against Omicron. But Dr. Cynthia Gibbous, a bioinformatics and genomics professor at UNC Charlotte, says Omicron has mutations that haven't been seen before.
They slightly change the shape of the molecule. That's why your antibodies that you have from the older virus versions might not be quite as good at this one, because it's like a little bit of a different shape. Your antibodies don't quite recognize it as well.
Right now in North Carolina, 58% of the eligible population is fully vaccinated, while 50% is in South Carolina. Getting vaccinated or boosted while Omicron isn't widespread can still help. The overwhelming majority of tests sequenced in the Carolinas are Delta, and research shows the vaccines protect against that variant.
That is why it is important for everybody to do these protective mechanisms. We don't know the degree to which the current vaccines are protective against Omicron, but they are likely to at least be somewhat protective. That there is a continuum. It is not an all or none phenomenon when it comes necessarily to these vaccines.
Health experts say it could be a few more weeks before they have the answers to those questions on just how severe Omicron will be and if it stands up to the vaccines. Meanwhile, officials say if needed, new vaccines can be developed in about 3 months. Live in Charlotte, Chloe Leshner, WCNC Charlotte.
All right, appreciate those updates. Chloe, thank you.